5 habits that damage your liver. The human liver is not only vital for metabolic function, but also plays a crucial role in blood detoxification, synthesis of blood clotting factors, immunity, and storage of essential nutrients such as vitamins and glycogen, to name a few. The following common habits can pose a risk to a healthy liver. Number 1. Over-consuming alcohol. It is no surprise that alcoholics have a much greater risk of developing jaundice, cirrhosis, liver failure, and several other disorders. Heavy drinking can be defined as consuming more than 8 drinks per week for women and more than 15 drinks per week for men. Chronic alcoholism is the leading cause of liver cirrhosis, which is characterized by scarring or fibrosis of the liver tissue. This happens when liver cells or hepatocytes are damaged and ultimately fail to function. Moreover, alcohol liver disease leads to complications such as fat buildup or steatosis, inflammation of the liver, hepatitis, and can even be fatal in case of multiple organ failure. Number 2. Poor diet. Consuming a diet full of unhealthy saturated fats found in red meat, butter, sugar, fast food, and processed meals results in hypercholesterolemia or increased cholesterol levels in the blood. The excessive fat buildup in the liver ultimately leads to non-alcoholic fatty liver disease, which is the most common form of chronic liver disorder in the United States, affecting 1/4 of the population. Fatty liver disease is characterized by high triglyceride levels and symptoms such as abdominal swelling, jaundice, and hepatosplenomegaly, or enlargement of the liver and spleen. Over-consuming sodium in the diet has also been linked to fluid buildup and swelling in the liver. Number 3. Excessive drug intake. Unnecessarily ingesting oral medication like painkillers, supplements, or medicinal herbs can lead to long-term liver damage known as drug-induced liver injury. Normally, the liver metabolizes drugs by the action of hepatic enzymes, which convert the fat-soluble drugs into a water-soluble form to be excreted out in the urine. Accumulation of drugs in the liver tissue due to overdose or overconsumption of medication can lead to cumulative liver damage and alteration in hepatic enzyme levels. Taking unnecessary doses of painkillers, anabolic steroids, and NSAIDs, or non-steroidal anti-inflammatory drugs, has been linked to the development of drug-induced hepatitis. Therefore, it is vital to take medication exactly as prescribed. Number 4. Smoking. Hazardous chemicals present in cigarette smoke promote the synthesis of cytokines, which are poisonous substances that lead to liver inflammation and even permanent dysfunction of hepatocytes. Smoking also yields carcinogens that have oncogenic potential, leading to hepatocellular carcinoma or liver cancer. Serum and hepatic iron levels are abnormally raised by smoking, which induces oxidative stress, causing fibrosis in the liver tissue. Cigarette smoking is also a major risk factor for the onset of non-alcoholic fatty liver disease and is known to worsen the condition of patients already suffering from a fatty liver. According to a study conducted in 2011, more than 50% of liver cancer cases were induced by cigarette smoking. Number 5. Sleep deprivation. Lack of restorative sleep can lead to hormonal imbalances, which ultimately alters the liver's metabolism. This may affect the liver's glucose and fat metabolism, increasing the risk of hepatic steatosis, or fatty liver disease, and diabetes mellitus. Several studies reveal a link between excess pressure on the liver and lack of sleep. Furthermore, biologists have found that sleep-deprived individuals are at a higher risk of cell injury, particularly in the liver tissue. People suffering from sleep disorders such as sleep apnea experience fatty liver disease at increasing rates than people without sleep problems. Shield your liver from deterioration by eradicating these habits. We are doing our bit to educate you with these common health issues. Do your part by sharing this video with your friends and social circle. If you want us to cover a specific topic,